Welcome back to the Anesthesia Board Review. Now we're going to talk about anesthesia for neurosurgery, focusing on closed head injury. A patient is brought to the ER after having been in a motor vehicle accident. You are called to the trauma room as the patient just arrives. Our initial assessment is divided into two separate surveys, the primary and secondary survey. The first thing we assess during the primary survey is the patency of the patient's airway. Next, we evaluate the respiratory status of the patient to ensure adequate ventilation and oxygenation. Thirdly, we evaluate the circulatory status of the patient to ensure adequate perfusion to the vital organs of the body. What are some of the concerns when managing an airway of a trauma patient? Several concerns that should be racing through your mind are the assumed C-spine injury that accompanies all trauma patients, the relative difficulty of the patient's airway in the setting of a bloody mass. The patient may have mid-facial deformities or perhaps laryngeal trauma, which turns what was a relatively simple airway into a nightmare, hellish condition in a heartbeat. Another major concern when establishing an airway is that